Ripe Fruit is a nonprofit education initiative dedicated to identifying and strengthening innate skills as they appear along the spectrum of ways we think and learn. Our mission is to infuse mainstream learning with enhanced curriculum, customized lesson plans, and demonstrated creative systems. We aim to foster comprehensive learning, enthusiasm, and confidence for all students. The Dean Talks serves as a conduit, think tank, and intensive to discuss how to identify and support unique learning styles.
I am a child, adolescent, and adult psychiatrist and mother, wife, and grandmother. So I both deal with kids in a regular way and then as a psychiatrist. And I've been in the field for a long time, graduated medical school in 1981 from the University of Maryland, and went through my residency in psychiatry through University of Maryland and Sheppard Pratt. So I've worked in many different settings and seen all sorts of kids with many different kinds of problems in school settings, outpatient settings, group homes, in my private practice. So basically, I guess all the kids I've worked with have been neurodiverse in some sort of way. So I could speak to what teachers might look for in a classroom setting to identify kids that they should get some help, or they should talk to the parents to try to see if they can get them some help so they could do better in school and better in life. So I think that summarizes who I am.
Yeah.
Well, I think probably one of the biggest changes is that the stigma of mental illness or having emotional problems or learning issues has lessened a lot, that people are much more willing to seek a diagnosis and to identify problems earlier. And that really is essential, identifying problems early on, especially with autistic children. And there's also there's been a slow but trend to really not blame parents for their kids' problems. That started a long time ago, and that's pretty much gone at this point, that you really want to identify kids and help parents accept their issues and realize that a lot of this is biological, or there may be environmental things that the family had no control over, because all parents come to the table feeling guilty or responsible somehow and wishing they could change the problem. So it's more a matter of helping them adjust to the idea of their child having some issues and helping them accept treatment. So I think that's been an overall positive change, but it's still very hard. It's very hard for parents to accept that there is something additional that they need to address with their children. It's hard enough just to raise normal, healthy children. So to add something on is, adds a lot of extra work that might need to be done. So that part is the same. For whoever is working with the family, though, it's important to recognize that different parents are going to have different perspectives, different things in their own childhood or their own past that are going to influence how they view their child's issues. For example, some people that have had a parent with a mental illness might find it, everybody's different, but some might find it hard to accept that then their child is struggling with a similar problem. So that can be something to keep aware of as the treating person. And for parents, that sometimes it's very hard for them to acknowledge what they went through as a kid, and to imagine going through it with their own child can be a difficult scenario. say that I would understand that it might be very difficult to accept a diagnosis, and maybe they're not ready yet, but that we could follow up with another conversation, that these are the things that now could really help their child that maybe in the past that weren't even available, that now there are so many strategies and even medications that can help a child that weren't available maybe to someone in their family in the past. And that it's much more hopeful, and let's try to work on it or keep talking about it. Okay. And I might, if it was identified in a school setting, I might say to a teacher or something, this might take a while, but, just be gentle about it and remind the parent that there is help out there, something like that. Well, I think I don't know, that's a difficult one, because there's a hard balance of still wanting to challenge people, not to just assume that they can't be as capable as someone else. So I think that's actually pretty tricky to do. But there might be more of an understanding, like let's say an employee became depressed. They weren't depressed originally, but then became depressed during work and are missing a lot of days. Then that's something that if the people in charge are aware of, they can try to address it in a nice way and say, well, this is something that you can get help for. The lost productivity at work is often because of depression, and we're willing to support you while you get help. You could have this much leave or whatever you need until you're able to come back to work, because depression is highly treatable, as is anxiety. But if they're just ready to fire the person right away, they may lose someone who in the long run is a highly valuable asset to the company. I mean, I've worked with people in my private practice where that's the case, that depression can undermine them when it gets severe, and they might not be able to work or be motivated. But once they get treated, they can be one of the top employees. So that less judgment from the bosses and higher ups, it can be very helpful. Well, the only thing is someone who's depressed would be insulted if he went overboard. So that's the trickier part. You don't want to make them feel like something's really wrong with them and you have to go way out of your way to help them out. So you want to balance that. You want to be supportive and not judgmental, but you don't want to think, well, this person's depressed. We really got to, sometimes you're enabling a person too if you don't still challenge them and expect them to be able to do okay if they go for treatment and do better. Mm-hmm. There's a confidentiality issue, which is that some people may not be comfortable saying what their diagnoses are, and also they don't want to be labeled as autistic. There's more to a person than their diagnosis. So I think that could be pretty uncomfortable. But if overall the company is aware that there are people out there that may have that issue, then they could think of accommodations. Or it could be employee by employee. As something comes up, they could address it in a non-judgmental way and work with the person to support them in getting help. And often help can be hard to get. So it depends on income and the availability of people out there, and there sometimes isn't enough mental health available. And that's been a chronic problem ever since I started my training. So despite us being more aware of the issues, there still is not as much money pumped into mental health as into other things. So I find that's always something that our society needs to work on, to realize how important everybody's mental health is. I think the problem is physical health does come first, because if you don't have your physical health, that really does interfere with what you can do in life. But part of that is our emotional health. kid. I think what you're talking about are accommodations more for, let's say, an autistic child or children with ADHD, because too much stimulation and things that can distract them are really difficult. So maybe an enclosed area or what you described, soundproofing, would really be helpful to kids with those issues. I was also just thinking of something else. Also, what a lot of teachers do for ADHD kids, because they have great difficulty sitting still, need to move around, get very restless, and can't focus for as long as other children. Often they'll assign them a task, like go to the principal's office with this, so that they get a little break, they get to go out of the classroom, or they might have them give out papers. So allowing them a bit more movement that's not disruptive can be helpful to a child like that. But the teacher has to be flexible, and there's a fine line between them getting disruptive. Some teachers have more difficulty with the child with ADHD, who might call out, be like a class clown, and others who are more aware of the diagnosis and what it means might be more accepting of that kid and their strengths. Because ADHD doesn't necessarily mean that the kid is not smart, but just that their lack of organization and their forgetting things and their distractibility can get in the way in the school setting. I mean, I guess an idealistic thing would be a whole different environment for where there's more outdoor activities, different styles of teaching or learning. I don't know, in public schools, though, if you're accommodating a lot of different kids, you can't change the whole environment just for some kids. So that's the tricky thing to do, unless you have a class of all kids with ADHD, which would be a difficult class to teach. So what those accommodate, but other kids might have anxiety or depression, or they might have learning disabilities. And there's actually so much more known about learning disabilities now than before. There's so many new ways to teach them and to give them the skills, or kids with dyslexia. So those problems used to not be identified that easily, and they just had to survive in the regular classroom. And now we actually have different teaching mechanisms and special tutoring for kids like that. And so they can be highly successful. I mean, even before we had those methods, there were often dyslexic people who found ways to be successful. So I think that we actually have a whole lot more now than we used to have. And problems are probably identified earlier. And that might be why people say there's so many kids with ADHD, what's going on? But maybe it's because we're identifying them earlier. And I'm with the more emotional, I think teachers might be more aware of kids being anxious. Like, let's say they might notice that they're trying to do a perfect paper, and so they keep ripping up their paper if it's not written beautifully. They might be missing school because they get so upset with stomach aches and headaches. So schools now have better ways of addressing that, with the kid coming in to see the nurse checking them out, them going to the classroom. I think here, in many settings, we are just more aware of these problems, and that's partly because the stigma is less. So we're more open to even recognizing them. It's not seen as something to judge a person by. And the same for depression. Teachers often identify if a kid draws black and gloomy pictures, or maybe even suggests that they might be thinking about ending their life. These are all things that in a lot of school settings, the teachers are much more aware of than in the past, and less judgmental of. I actually haven't done that much of that work, but I think it's, from what a professional like me would do, would be more to educate the teachers about the different diagnoses and the different problems that there are, so that the teachers could then work with the parents. I suppose a professional could host like at a PTA meeting or something, could host a meeting about particular diagnoses and have parents come to that. Might be one way. Also, pediatricians, I have some pediatrician friends that really work hard, are actually trying to address adverse child experiences with parents. When they see them in their office, they actually have a survey or a form, I think, that parents fill out, and then they might try to address that with the parent in those sessions. So pediatricians, I think, are a major resource to help bring more knowledge to parents and educate them. Well, the first thing that a psychiatrist or a psychologist or social worker would do was try to find out more what is behind their reluctance, the parents' reluctance to accept the diagnosis. So you'd ask more about that. Well, what is it like for you when I'm telling you this? What is your reaction? Any idea where that comes from? And to then be empathic to whatever they're telling you, and to try to turn it into something positive, that there is this diagnosis and there is something to do about it. So there has to be some understanding of where the parent is coming from before you can really help them take steps to work on that and eventually change their minds. A lot of students, when I work with students at the college counseling centers, the therapist sees them first and has built up a really good rapport with them. And a lot of the students are very reluctant to start medications. So the therapist really takes a lot of steps to help them see, well, look, you can see the psychiatrist. You don't have to start anything. You're just finding out more about medication and more about what it could do. So the idea is that they're coming in to see me with an open mind, and to realize that I have an open mind. I'm not going to say, you've got to be on this medicine, or else I'm going to educate them about what the medicine can do and whether I even think it's something they need. And then they'll take it from there. It's their choice. So as a professional, I have to be aware that, hey, they may not accept this help from me immediately. And sometimes professionals can take that personally and not take that personally, but try to understand where they're coming from. And that could apply the same to a teacher in trying to understand the parent, and or a supervisor. But they don't necessarily have to get into it in a therapeutic way because that's not their training. So is that helpful? Or?
Oh, yeah, absolutely. I think something that resonated the most with me is that you said you don't have the judgment. You just allow them to kind of come into the knowledge and acceptance, and you don't maybe force them to take a medication, I think is what you said.
Which you can't do anyway. So.
Right.
But you might come off as trying to do that too much. I mean, you don't say you've got to be on this medicine or else, I mean, not exactly, but come across with a tone that's more pushy and forceful. You don't want to do that.